In a matter of days, Hong Kong went from being an example of how to contain COVID-19 to a city struggling to rein in record-high infection numbers. In the early stages of the pandemic, Hong Kong authorities moved quickly to announce social distancing measures, isolate those infected, and to quarantine any close contacts in government facilities as a precaution to limit the spread of the coronavirus. Hong Kongers remembered their experience from 2003 with another coronavirus, SARS. So this time, people wore masks, businesses started regularly disinfecting their premises, and temperature checks became more commonplace around the city. As the number of infections soared in much of the world, Hong Kong's quick action helped keep local case numbers down. After riding out a second wave in March, when there were dozens of cases per day, the city more recently enjoyed 3 weeks with 0 local COVID-19 infections. But July 5th marked the beginning of Hong Kong's so-called third wave. In 1 week, 173 new infections were recorded, 107 of which were locally transmitted. In a little over 3 weeks, the number of infections increased to more than 1,400. What's more alarming is that officials have not been able to trace the origin of many of these new infections. So what caused Hong Kong's third wave of COVID-19? Health experts say it could be groups that were overlooked during screenings for the disease. Using health department data, the Post found that between July 8th and July 19th, 3 in 10 imported COVID-19 cases in Hong Kong were mariners or aircrew members. These pilots and cabin crew, or sailors, were exempt from a 14-day quarantine that applies to most people who arrive in the city. Even though tourists have all but disappeared from arrival halls, Hong Kong has remained an air and sea cargo hub throughout the pandemic. COVID-19 cases among sailors and aircrew members were not detected until mandatory testing started being required for the group on July 8th. Data from Hong Kong's Transport and Housing Bureau shows that around 11,730 sailors have been exempted from quarantine since February. And since June 8th, the city has been allowing ships to swap crews freely without undergoing quarantine or virus testing. Dr. Liang Chi-Chu, who chairs the Hong Kong Medical Association's Advisory Committee on Communicable Diseases, told the Post infected crew members could have spread the disease without knowing it, by using public transport or taking taxis to get around the city. Researchers at Hong Kong Polytechnic University recently found that strains of the virus sampled from more than 20 recently confirmed local cases were nearly identical to those found in imported cases from the Philippines, Pakistan, and Kazakhstan. Domestic workers are another group that seems to have been overlooked. Looking at health department data from July 8th to 19th, the Post found that 1 in 4 imported COVID-19 cases were domestic workers. Dr. Liang says the figure is worrying since the government only announced on July 7th that it was looking into asking employers to quarantine recently arrived domestic workers at hotels. In that time, infected workers could have already spread the coronavirus in the community. Health experts also say the government's lack of swift action, as well as public complacency, contributed to this third COVID-19 wave. As case numbers began to rise, the government did not give civil servants an option to work from home. Dr. Ho Pak Leung, an infectious diseases expert from the University of Hong Kong, says the government sent a wrong signal to the private sector and overall community about the severity of the virus's spread. Back in June, when it looked like Hong Kong had COVID-19 under control, the government began to relax social distancing measures. Restaurants were allowed to fill up to capacity, cinemas, gyms, karaoke bars and other venues were allowed to reopen, and a limit on gatherings was raised from 8 people to a maximum of 50. The relaxed measures may have made Hong Kongers think that the worst was over, and they may have let their guards down on measures such as wearing face masks and regular hand washing. Now, as government restrictions are reinstated, some of the rules are more strict. Scientists from Hong Kong PolyU have also done a comparison of samples taken from recently infected patients to study the pace of coronavirus mutations. Their research suggests that the virus has effectively adapted to humans and become more transmissible. A top health advisor to the Hong Kong government, Dr. David Hui, agrees the virus appears to be more infectious than it was during the first 2 waves seen in the city. Hong Kong's Health Secretary, Dr. Sophia Chan, says authorities will follow up on the study. In the meantime, Chan is urging the city's residents to show more self-discipline and patience. And Chief Secretary Matthew Chung has appealed to Hong Kongers to stay at home as much as possible and reduce social contacts. After so much effort in the first half of the year to control the virus, it appears that Hong Kong, at least for now, is back to square one.